morning all. Today's topic is water soluble vitamin, the vitamin B complex and its group. Now, thiamine, chemistry and sources. A colorless crystalline compound containing a pyrimidine and thiazoles ring. It is present in uh, the outer layer of the cereals, rice and polished pulses, nuts, green vegetables, yeast and egg and meat. Here the given the table where the all vitamins uh, and the chemical forms and thermostability and daily allowance and properties. You can read and prepare the fat soluble vitamins and water soluble vitamins in from the table. Now the absorption fat of the here the physiological amount are absorbed by the active transport when large doses are given orally. Some passive diffusion also occurs. Limited amounts are stored in tissue. About 1 mg per day is degraded in the body and excess is rapidly excreted in urine. Now physiological role. After conversion in the body, the thiamine pyrophosphate it acts as a coenzymes in carbohydrates metabolism and decarboxylase of ketosides and hexose monophosphates shunts and required is dependent upon carbohydrates intake about 0.3 mg per 100 kilocalorie. It also appears to play some role in the neuromuscular transmission. Perithiamines and oxythiamines are synthesized thiamine antagonists. Tea also contains a thiamine agonist. Deficiency symptoms. The symptoms of the thiamine deficiency beriberi is seen in the dry and wet form. Dry beriberi neurological symptoms are prominent and polyneuritis with the numbness, tingling, hyperexia and muscular weakness and atrophy resulting in wrist drop, foot drop, paralysis of whole limb and mental changes, sluggishness and poor memory and loss of appetite and constipation. Wet beriberi cardiovascular symptoms is primarily affected palpitations, breathlessness, high output cardiac failure and ECG changes and protein deficiency is commonly associated and added to the generalized anasarcas due to the CHF. Now therapeutic uses prophylactically 2 to 10 mg daily in infants and pregnant women, chronic diarrhea, patients on the parenteral alimentation and glucose infusions unmasked and marginal thiamine deficiency. Beriberi 10 mg per day, IM or IV. Acute alcoholic intoxications, thiamine 100 mg is added to the each vaccine glucose solution. Now in the neurological or cardiological disorder, hyperemesis, gravidarum and chronic anorexia and absence constipation, thiamine has been used for without definite proof of the deficiency. Its average effect, thiamine is non-toxic sensitivity reaction sometimes occurs in the parenteral injection. Now riboflavins, vitamin B2, chemistry and sources. Yellow flavum can or compound found in the milk, egg, liver, green leafy vegetable and grains. Absorption and fat well absorbed by the active transpiration and the phosphorylate in the intestine. The action and physiological role, flavin, adenine, uh, denucleated FAD, and flavin mononucleotide FMN are coenzymes of the flavoprotein and protein and involved in the many oxidation reduction reaction. Deficiency symptoms. Riboflavin uh, deficiency generally occurs in the association with other deficiencies, characteristically lesions and angular stomatitis and sores and raw tongue, lips, throat, ulcer in the mouth, and vasodilation of the cornea and dry sclera skin, loss of hair, anemia and neuropathy develop later. Therapeutic uses to prevent and treat erythroflavonosis generally along with the vitamin B complex member. This is no proof of the benefit in the other condition. Niacin, vitamin B3 chemistry and sources. Niacin refers to the nicotinic acid as well as a nicotinamide pyridine and compounds initially termed pellagra and preventing factors. Sources are liver, fish, meat, cereals, husk and nuts and pulses. The amino acid tryptophan can be regarded as the provitamins as it is partially converted into the body to nicotinic acid. Absorption and fat. Niacin is completely absorbed from the gastrointestinal tract. Physiological role and action. Nicotinic acid is rapidly converted into the amide, which is a component of the coenzymes nicotinamides, adenamide, dinucleotide NAD, and the phosphate NADP involved is oxidation reduction reaction. Deficiency and symptoms. Niacin deficiency produce pellagra, cardinal manifestations of the which the dermatitis, sunburn like the dermal rashes in hands, legs, face, and which later turn back, crack, and peel. Diarrhea with enteritis, stomatitis, glossitis, and salivations, nausea and vomiting. Dementia with hallucinations preceded by headache, insomnia, poor memory, motor and sensory distribution. Anemia and hyperproteinemia are commonly in pellagra. Chronic alcoholism are the particularly at risk and development of pellagra. Therapeutic uses prophylactic 20 to 50 mg per day orally. Treatment of the pellagra 200 to 500 mg per day, divided dose orally or parenterally. The Hartnupp's disease, in which tryptophan transport is impaired, and the chronic carcinoid tumors, and its nicotinic acid has been used in the peripheral vascular disease. The adverse effect, nicotinic and pharmacological doses may has many side effects, toxicity, nicotinides in the introduction. Now, pyridoxines, vitamin B6 chemistry and sources. Pyridoxine, pyridoxal and pyridoxamine are related naturally occurring pyrimidine compounds that have vitamin B6 activity. Dietary sources are liver, meat, egg, soybean, vegetable and whole grain. Absorption and fat. All three terms of the vitamins are well absorbed from the intestine. Physiological role and reaction. Pyridoxines and the pyridoxamines are readily oxidized to the pyridoxal, which is then the phosphorylate to the pyridoxal phosphate, and it's the coenzymes form and uh, paradoxal dependent enzyme including transaminases and the uh, decarboxylase involved in the synthesis of the non-essential amino acid. Drug and interreactions. Isoniazide reactions are paradoxal to form hydrogens and thus inhibits generations of the paradoxal phosphate, and isoniazide also combined with the paradoxal phosphate. Here the deficiency symptoms. Deficiency uh, of the vitamin B6 usually occurs in the associated with that of the other vitamin B6, and symptoms and that vitamin ascribed to the pyridoxine deficiency are seborrhea and dermatitis glossitis. Therapeutic uses prophylactically 2.5 mg per mg daily, preventive orally 10 to 50 mg per day, and the treatment of symptoms humans and oral contraceptives 50 mg per day. Pyridoxine reabsorption anemia and homocystinuria are rare genetically disorder and a convergence by infants in children. Thionic acid and butanic acid, which are also used. Its sources is especially liver, mutton, egg yolk, and vegetables. And biotin is also again egg yolk and liver, nuts, and any other nut. Now, vitamin C, chemistry and resources. Ascorbic acid is a 6-carbon organic acid with the structural similarity to the glucose. It is potent reducing agent and L form is biologically active. Absorption and fat. It is necessary compound absorbed from the GIT and widely distributed extra and intracellular plasma containers and the total body store. Physiological role and action. Vitamin C plays a role in the many oxidative and other metabolic activities. Now here the table of the combination of preparation of the vitamins, and you can read and learn from this table. Now deficiency and symptoms. Severe vitamin C deficiency scurvy, once prevalent among soilers and is now seen in only malnutrition infants. Therapeutic uses prevention of cirrhosis and deficiency in the individual at risk, and treatment of the scurvy 0.5 mg to 1.5 daily per day. Possibly 500 mg daily through the vitamin C does not enhance normal healing. And C anemia, ascorbic acid enhanced iron absorption and frequently combinations with the ferrous salt. The acidify urine 1 gram TDS QID in the urinary tract infections. Large doses 2.6 gram per day of the ascorbic acid have been tried to the variety of purpose. Now adverse effect. Absorbed acid is a well tolerated in is used dose. Mega dose given for long periods can cause rebound, scurvy, and stoppage, probably due to the enhancing of its own metabolism. Vitamin D, already we are studying in other chapters.